I'll tell you a very short story. Many years back when I started my clinical practice, I saw a patient came to my clinic and he was telling about himself, and I still remember one of the sentences that he said. He was a very rich guy. He had tens of crores of rupees in his bank and had multiple properties, was driving a big car, and he told me, "Doctor, I have enough money." One day I was calculating, and I calculated that for the next 15 years, even if I don't earn a single more rupee, and if everybody in my family spends a lot, lives a luxurious life, even then for the next 15 years there is no problem of money. But doctor, I'm very scared. A thought keeps on coming in my mind that what will happen in the 16th year. These were his exact words. That patient had generalized anxiety disorder, and this thought, which may appear very weird to you, that a guy who is so rich that who does not have to work at all and spend freely, still does not run out of the money for next 15 years. Why is he thinking about the 16th year? But this is what anxiety does. Anxiety shows us the worst case scenarios and presents those scenarios to us as if they are about to happen. The anxiety thought of that person who had GAD is not very different from the anxiety thoughts that our students come up with. Say you had a thought that I forget everything that I studied in the past. Ask yourself, is that thought really true? Do I really have any evidence to back that thought? And then you think logically. You think about probably 10 MCQs that you tried doing. Maybe you had forgotten 6 out of them and remembered 4 out of them. Even that does not mean that you have forgotten everything. Even if you're able to recall just 40% of the course, even that does not mean that you have forgotten everything. That is the evidence against your thought, right? So first thing, just because I had a thought, I'm not going to accept it at the face value. You have to tell yourself that just because I had a thought, I'm not going to accept it at the face value. What is the second step? If you're still getting these thoughts, you can ask yourself, what is the basis of this thought? Otherwise, what happens? Say you are studying orthopedics and the thought came that I cannot remember anything from dermatology. Immediately what you feel is you're feeling anxious, you're feeling keyed up, you're feeling worried, and you're not able to concentrate, you're feeling restless. Rather than focusing on the studies, you start doing something else. All these thoughts are very powerful. They will impact your motivation levels, they will impact your behavior, they will impact everything. They will impact they impact your body also. You start having palpitation, you may start feeling sweaty. So these thoughts are very strong, and when we label these thoughts that this is overgeneralization, or when we say that this thought is not true, or when we do that thing, what is the basis of this thought? Then you take the power out of these thoughts, and then these thoughts are not able to trouble you. So do that.